This year, almost 10,000 women in America will be diagnosed with cervical cancer, and an estimated 3,700 will die. In Louisville, we can expect that about 39 women will get invasive cervical cancer this year, and that 19 will die. But it doesn't have to be this way. Today, we'll tell you about what you can do to help protect yourself against cervical cancer. We'll also tell you about a wonderful new vaccine that can prevent 70% of all cervical cancers. We'll tell you about a new collaboration to bring additional cervical cancer screening and breast exams, as well as other cancer screening to people throughout our community. On today's show, we'll talk to Dr. Sandra Brooks of the Norton Cancer Institute and to Virginia Bradford of the Kentucky Cancer Program. They'll be sharing with us information on the new cervical cancer vaccine. We'll also talk to Kay Hetty of the Louisville Metro Department of Public Health and Wellness. Kay will tell us about the department's role in making the new cervical cancer vaccine and cancer screenings available to women throughout the community. So stay tuned. We'll be right back. Joining me now is Dr. Sandra Brooks. Dr. Brooks is a GYN oncologist and Associate Vice President of Cancer Prevention Services at Norton Cancer Institute. Dr. Brooks, welcome to Health Matters.
Good afternoon.
I want to start by asking you about cervical cancer and this particular month. What is exactly is cervical cancer? What causes it, and why are we more concerned about it this month than other times?
Well, cervical cancer is, while it's not as common in the U.S. as worldwide, it is one of the cancers that are preventable. Cervical cancer is caused in part by a virus called human papillomavirus. Human papillomavirus gets inside the cells of the cervix, takes over those cells, and makes the cells grow abnormally. The other aspect is that it doesn't happen overnight. Typically, there are years of these precancerous changes before a cancer develops, and that's why pap smear screening is so important, and now with this new vaccine, why getting people educated about what the vaccine and what it means is so important as well.
For the one or two people in our audience who don't know exactly what a cervix is, could you describe that for us?
Sure. The cervix is the part of a woman's body that is the part that dilates when a woman is getting ready to have birth. So it's the opening to the womb, essentially. Mm-hmm. So part of the woman's reproductive system, the uterus is on the inside, the cervix is actually visible through the vagina. And when a woman goes for a GYN exam, the doctor or provider can see the cervix, take a scraping of cells from the cervix and send it to the lab to see whether or not there are any abnormal cells.
And how long has it been that we've known this relationship between what you described as the human papillomavirus and cervical cancer?
Many years, more than 20 years, we've known that there's a relationship between HPV and cervical cancer. What was not known in the beginning was whether or not all types of human papillomavirus, because there are more than 100 types of human papillomavirus. Not all of them cause cancer. There are some that cause health problems, but not cancer. For example, genital warts. The new vaccine that you may have heard about, it actually protects against the cancer-causing types of the virus and also protects against some of the types of the virus that can cause warts.
So are you saying that what science has determined is that this is a cancer that's actually caused by a virus?
It is. Now, it's not, thousands of people will be exposed to the virus, but only a relatively small percentage of them will actually develop cervical cancer. So that's not the only thing. We know there are other things that can put a woman at risk for developing cervical cancer. Smoking is one of them. Being anemic or having a low hemoglobin. For some reason also having multiple children tends to be a risk factor. But in terms of those risk factors that a person can potentially take action about, smoking and clearly exposure to human papillomavirus.
Mm-hmm. So then can you tell us something more about the vaccine, perhaps even how it works and how one gets the vaccine, how is it administered? Just give us some more information about, this may be a very new idea for people who are listening to this show,
right.
That there's a virus that causes cancer, or a certain kind of cancer, and there's a vaccine that in fact may have some preventive benefit to the audience listening to us?
Right. The virus is made, the vaccine is made of something called a virus-like particle. So it behaves like the virus in the body once it's administered. It's administered through a series of injections, usually in the arm, over the course of 6 months. So 3 injections would be given over the course of 6 months. Once the vaccine is given, the body feels like, oh, this is a virus, and it reacts to it by forming antibodies. Antibodies are protective in most cases. And in this case, if then on down the line the person would be exposed to the real human papillomavirus, then that person would not develop a disease as a result. And it's important to mention that the vaccine protects against the 2 of the types of the virus that are most likely to cause cervical cancer, really 70% of cervical cancers. So not 100%, but 70% of the types of human papillomavirus that causes cancer. And the viruses that can cause genital warts, just 2 of the many types of viruses that can cause genital warts.
So then theoretically, if someone gets the injections, the 3 injections over 6 months, as you indicated, they should have protection from roughly 70%, or roughly 70% of people who might be exposed would be protected from getting cervical cancer if they've gotten this 3 vaccine course.
Right. So they're protected against most of the viruses causing cervical cancer and most causing these genital warts.